Hello, everyone, and thank you for joining us. My name's Michael Fotheringham. I'm the Managing Director of AHURI, the Australian Housing and Urban Research Institute, and I'm delighted to welcome you to the AHURI Research Webinar Series once again, the 18th instalment of the series now. Before we begin, I want to acknowledge that I'm hosting this webinar from the lands of the Wurundjeri people of the Kulin Nation. And I also acknowledge the traditional custodians of the various lands on which you're all working today and the Aboriginal and Torres Strait Islander people participating in this webinar. And I pay my respects to the elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters throughout Australia. Before we commence today's webinar, I'm pleased to announce that the National Housing Conference will be held from Wednesday 2nd to Friday the 4th of March 2022. And for the first time, it'll be both in-person and virtual, a hybrid National Housing Conference. We're really pleased to say that's going ahead early next year, hosted in Melbourne, and look forward to seeing as many of you as possible there. Look, we're really pleased to say that our webinar program will also continue as part of our ongoing public events program as we start to re-emerge in many parts of the country and have face-to-face events again, and hopefully in Sydney very soon. Before I introduce today's topic and speakers, I need to provide you with a few instructions on the software, some housekeeping. This webinar is being recorded, so if you want to return to it later or you want to forward it on to a colleague, the recording will be on the AHURI website in the coming days. At the end of today's webinar, you'll also receive a survey. We really do take notice of that feedback. We listen to that feedback so that we can refine and improve future webinars and events. And so I really encourage you to fill in the survey and let us know what you think. We really want to make sure that we're presenting information in a way that's useful to you. In terms of participating in today's webinar, the instructions are reasonably straightforward. You'll have the opportunity to submit questions by typing them in through the Q&A section on the right of the presentation screen. Right, let me try the mirror goes. You can submit your questions at any time during the presentations, and we'll collate these and address as many of them as we can during the Q&A segment following today's presentation. On to today's topic and presenters. So I'm delighted to welcome you to today's theme, Housing Key Workers in Australian Cities. Our presenter today is Dr. Catherine Gilbert from the University of Sydney. Catherine's the lead author of the AHURI report, Housing Key Workers, Scoping Challenges, Aspirations and Policy Responses for Australian Cities, which examines evidence of housing affordability challenges amongst a range of key worker occupations in Sydney and in Melbourne. The report, along with a policy evidence summary and a standalone executive summary, are now available on the AHURI website, but also available here on the webinar page in the handout section to the right of your screen. Catherine is a postdoctoral research associate in the School of Architecture, Design and Planning at the University of Sydney and currently holds an AHURI postdoctoral fellowship. Her research is focused on examining the implementation and outcomes of planning reforms and inclusionary planning policies designed to increase the supply of affordable housing, as well as on examining evidence of the impacts of declining housing on specific cohorts. I'm also delighted to welcome Leonie King as the respondent following the research presentation. Leonie is now the CEO of City West Housing. She has over 2 decades of experience as a senior executive in government and non-government sectors. And she's also currently a director on the board of the Community Housing Industry Association and vice chair of CHIA New South Wales. Today's format for the webinar will include a research presentation, followed by a short industry response from Leonie. After that, I'll facilitate a discussion between our 2 participants and take your questions from the audience. So feel free to ask a question at any time throughout the presentations, and I'll do my best to include as many as possible through the formal Q&A session. So it's now my pleasure to introduce you to our main presenter, Dr. Catherine Gilbert.
Thank you, Michael, and thanks everyone for coming along today. So I'm going to share the findings from this research looking at housing affordability for key workers, mostly focusing on Sydney and Melbourne. And this work, I should say, was undertaken with my colleagues, Dr. Zara Nasreen and Professor Nicole Gurin. So let me just drive this. So what I want to do is provide a little bit of background on this study, and then what I'll do is spend the majority talking about the findings. So this is a very data-rich project. We generated a lot of data, so I won't go into every single detail in this presentation just due to time, but there's a lot more detail in the report. So this is a scoping study, which was a new AHURI research model. So these scoping studies, they're conducted over a shorter time period than a traditional project. And what they're designed to do is generate new evidence on emerging issues that we don't have a lot of empirical evidence around, and to look at opportunities to conduct further research and policy development in these areas. So when we actually started this research, what we knew is that declining housing affordability, particularly in inner areas of Sydney and Melbourne that are quite job rich, is creating a spatial mismatch between the location of jobs and housing that's actually affordable to lower income workers. And we know from the research evidence that lower income working households are responding to this declining housing affordability near employment opportunities in a number of ways. So one is by undertaking extremely long commutes, often from outer suburban or even outside of metropolitan region areas, from satellite cities into central city jobs. They're taking on unaffordable housing costs, which are putting them into housing stress. In some cases, particularly younger, lower income workers are sharing housing either by living with family or living in group housing. And another response, which has been documented in the media, less so in research, is a suggestion that younger people are actually moving outside of metropolitan regions in search of a better lifestyle and more affordable housing options. So we know, of course, that these responses are problematic for cities. They can have implications for economic productivity and environmental sustainability, particularly when we're talking about very long car-based commutes. And we know that commuting and housing stress can have significant implications for individuals' health and well-being, which can have repercussions for wider aspects of their life, including work. But what we didn't really know when we started this research was how workers who perform essential public services but earn low and moderate incomes are being impacted, and what this actually means for cities and what the risks might be in some of these outcomes. So there was a little bit of research and policy interest in key workers in the 1990s when the issue was really first identified, the key worker problem. But then there wasn't a lot of interest, and we're seeing a bit of a resurgence now. So certainly this question of how people who perform essential public services are being impacted by declining housing affordability has become really, really important in the context of the COVID-19 pandemic. So the pandemic's really served to highlight the important role many low and moderate income workers play in the functioning of cities, and importantly, in their resilience to crisis events like we've seen. But it's also served to really highlight the role housing can play in exacerbating risks. So, for example, if essential workers are forced to travel across large parts of the city to access their jobs, there's a risk there. Or if workers are living in housing where they can't actually self-isolate. So these actually create additional risks for cities in events like we've seen. So these concerns, we're seeing them in Sydney at the moment, we've seen them in Melbourne in the past, and they're not unique to Australia. Similar stories are coming out of London, Southern California, Toronto, and with that, there's been a renewed interest in this key worker challenge. So our research, we had 3 aims. So it was designed to scope evidence of first whether and how governments both in Australia and in the UK and the US are considering key worker housing needs and supporting key workers to access housing. So we wanted to see what types of programs exist, how are key workers defined within those programs, and sort of what is it that they're trying to do, how do they work. And then really the bulk of our empirical work was looking at evidence of the housing situations of key workers on different low and moderate incomes in Sydney and Melbourne, and then looking at potential policy responses. So we conducted the research over 4 stages, which broadly aligned with those aims. So first we did a policy and program review. So we looked at examples of policies, programs, even specific projects to look at how they worked. Then we did an analysis of housing affordability and for a range of different occupation groups, and we used indicative wages for different occupations that were derived from industry award scales. And in some cases, we had to use averages published by job websites like Seek. And then we used LGA median house prices and rents. So we recognize that, in reality, of course, income is influenced by many factors, such as hours worked, career stage, whether there are other income earners in the household, and also, of course, that house prices and rents vary significantly across a local government area. But really our aim was just to identify some broad geographic patterns of affordability as part of the scoping study. Then we looked at evidence of the housing situation, commuting patterns, and residential moves of key workers across 21 different occupation groups using 2016 census data, which was the latest that's available. So we're eagerly awaiting the next round of the census. Our analysis was mostly conducted with using the geographic units of the subregion and the local government area. And we, of course, included all those within each greater metropolitan region, but we also looked at satellite cities and adjacent subregions and local governments, recognizing that people in reality are commuting in from outside. And then finally, what we did is we conducted a small number of interviews with people who have expertise, who either represent different types of key workers or have expertise in housing and labor markets and planning in Sydney. And the aim of that really was to see if our findings resonated with them, to understand some of the nuances in our data, and of course to explore potential policy responses. So these are the occupation groups that we looked at. These are based on the ABS 4-digit occupation categories, so which in some cases were combined. So of course this list is not exhaustive. We've taken a very broad definition of what a key worker is beyond sort of those traditional core occupations, which I'll talk about in a minute. But I mean, arguably we could include others, and we were somewhat limited by what the census occupation categories are. Okay, so moving into our findings. So what we found in our analysis of existing policies and programs, is that there's absolutely no universal definition of what a key worker is. There's also no universal terminology, so often essential worker, frontline service worker, they can really mean the same things. So there's what we've called a traditional or core definition, and those occupations are almost always included. And they're low and moderate income public sector workers in education, healthcare, policing, and emergency services. But in the context of defining key workers for the purpose of administering policies and programs, we found that definitions can vary, so they can sometimes include support workers in those traditional industries. Sometimes they extend to the broader public sector, recognizing that wages can be lower than in the private sector. They often focus on occupations that have significance to local labor markets. So things like hospitality or tourism workers, university workers, jobs that support the broader workforce, so childcare workers, ICT support technicians. And particularly in the context of COVID, I think there's been increased recognition that people like delivery drivers and couriers, retail workers, for example, in food services, and public transport workers are very vital as well. So quite a flexible definition. What we've seen is, for example, in the UK, there's a requirement within the National Planning Policy Framework that local authorities consider the housing needs and plan for the housing needs of essential workers, but there's some flexibility for local authorities to define what a key worker is in relation to their own their own labor markets and what evidence there is of recruitment and retention difficulties. Now, what we also found coming out of our policy and program review was that there's a clear rationale for public sector support of workers in these occupations that extends beyond just the argument for providing affordable housing for the general labor force. So one of those is that for these jobs, they are almost predominantly performed face-to-face, or face-to-face is a much more better outcome than performed remotely. So physical location is very important. And for some occupations, particularly emergency services, some welfare support roles, and healthcare, proximity is essential for workers in order to be on call and to respond quickly to emergency situations and spikes in service demand. And of course, there is a wider public and economic benefit to providing high quality essential services and having a well-functioning city. So that's a clear rationale. But there's also recruitment and retention risks. And this derives from the fact that these jobs are population serving, which means that essentially there are jobs available where there are resident populations. So there's not necessarily an incentive to work in expensive housing market areas. There's in fact a disincentive. So workers may be able to, this isn't the case for every single occupation, but for many, there's an opportunity to work in less expensive cities, and there actually needs to be some intervention to retain more experienced workers and recruit them to more expensive areas. So what we found overall, and of course there's more details in the report, but we found that in Sydney and Melbourne, in those contexts, policies and programs and specific projects that support key workers' housing needs are relatively sporadic over time, and in terms of individual sort of projects. There is increased recognition of essential workers in strategic planning, so being captured in local housing strategies and named. But there's been really a lack of consistent funding and enabling legislation to deliver affordable housing programs, and so that in some ways has stifled the delivery of actual housing units. In the US and the UK, there are much longer standing programs that target both the supply and demand side, so helping key workers to purchase homes, for example, as well as delivering housing for rent and for purchase for key workers. And I mean, there's still, they're not a fix-all, they're still highly oversubscribed, but there is, those programs do exist. And I think what's really, really important is that those policies and programs we looked at that are specifically targeted at key workers, they actually sit alongside or within broader programs that support moderate income households by delivering intermediate types of affordable housing, so situated sort of between social housing and private market housing on the housing spectrum. So here's some examples of the types of assistant measures that exist. So on the supply side, planning and zoning requirements that support delivery of affordable housing that's marked for essential workers. The use of negotiated planning agreements with developers have been used to deliver housing. We found examples of capital grants to affordable housing providers for the delivery of key worker housing. In the US, there was an example of low-rate loans being given to developers to deliver rental housing for moderate income workers. And also, there were special planning provisions to support or enable employers to develop housing for key workers. Then in the US in particular, there's quite a lot of programs that sit on the demand side. So that's offering down payment or purchase cost assistance to essential workers. This one's a little bit, I don't know how this plays out, but offering 95 to 100% mortgage finance to eligible key workers. and then shared equity loans and shared ownership programs. All right, so now I'm going to delve into some of our findings looking at the situation of key workers in Sydney and Melbourne. Okay. So what these maps show, this is the broad geographic patterns of affordability that I mentioned earlier. So it's probably hard to read the legend, but what essentially anything that's green, we found that the median price is affordable on a key worker income. Anything that's red or orange, we found it was not affordable. The red being extremely unaffordable and the orange being moderately unaffordable. So the occupation groups that we looked at, those 21 occupation groups, they earn incomes that range from sort of the low second quintile to the mid third quintile for their respective cities. So that's sort of where they sit. Based on the 2019 median prices that we used and indicative full-time salaries, we found that no metro region LGAs are actually affordable to key workers who earn those second quintile incomes. So those are people like laundry workers, commercial cleaners, child carers, and enrolled nurses. We found that LGAs with an affordable median unit or house price for someone earning a third quintile income, so people like a registered nurse, are extremely limited, and they're really confined to outer suburbs and in some cases satellite cities and regions. But it's really important to note that this isn't just an inner ring issue, that actually some satellite cities, like traditionally more affordable places like Wollongong, actually have now unaffordable median prices, and some coastal areas. So you can see the Surf Coast, the Mornington Peninsula, and Kiama on the south coast actually are very unaffordable too. So this is just another map. So this is actually showing affordability of a median priced house on an indicative salary for an early career teacher. So, I mean, you can see there's a lot of red on the map, very limited areas that have affordable medians, and they're extremely, extremely far out from the metropolitan region for the most part. So there's also problems for rental affordability. So what we found is rental affordability, this is using rents for late 2019. So, you know, both of the housing markets have changed since we actually conducted this analysis. And so, you know, possibly these figures would be worse. But rental affordability is also a problem across much of Sydney and Melbourne. And again, it's not just a central city problem. You can see that even in some outlying areas, you know, rental affordability is also a problem. So these maps are showing affordability of a median priced one-bedroom rental for a delivery driver or a childcare worker. Okay, so given this geographic pattern, it's perhaps not surprising that we found when we looked at the 2016 census data that key workers are more heavily concentrated in outer suburbs and satellite cities. So we performed a shift share analysis. So what it did was look at where key workers actually live, where their place of residence is relative to the distribution of the general labor force. So a result close to 1 indicates that the concentration of essential workers in those 21 occupation groups would broadly align with the distribution of the metropolitan region's labor force generally. But what we found, for example, you can see in the table there that a lot of outer suburban and satellite cities and regions actually have high concentrations of the greater metropolitan region's key workers. And I mean, I haven't included that information here, but if you looked at some inner suburbs, you'd get numbers like 0.5. And we found that over a third of key worker jobs are actually located in inner subregions. So yes, key worker jobs are distributed across the metropolitan region, but there is a significant concentration in inner subregions, which contrasts to the location of where essential workers tend to live. And that's particularly true for public transport, nursing, laundry and commercial cleaning, and policing and fire services. So there's an opportunity to achieve employment self-containment with essential workers because their jobs are distributed across the metropolitan region. But we found in reality, employment self-containment is very low for inner subregions. So very few key workers both live and work there. Key workers are more likely than the general labor force to commute more than 30 kilometers to work. And to commute by private car. That's often to do with the time that they're working. Key workers, and we found examples of key workers commuting from outside the metropolitan region, from places like the Blue Mountains, the Central Coast, the Illawarra, and Geelong into the inner city. We found that key workers in our occupation groups tend to live in larger households than the general population, but that's partly due to their age profile. Key workers in lower paid occupations are more likely to live in 2 and 3 family homes and in group households. We found that a significant number of key workers are living in overcrowded homes, so 31,000 in Sydney and 18,000 in Melbourne. And you can see for the inner subregions what the proportions are for specific occupation groups. So the first one there is commercial cleaners. So almost 45% of commercial cleaners in the inner subregions of Sydney are in overcrowded homes. So it's much more prevalent in inner subregions and amongst lower paid occupation groups. But we also found that there were 34,000 teachers and over 4,000 registered nurses who were also living in overcrowded homes. So it's not just confined to lower income groups. We also found that there's examples of key workers living in households that can be classified as being in housing stress. So 52,000 or 20% of Sydney's essential workers, 26% of renters, 37,000 or 17% in Melbourne, 20% of renters can be classified as being in households that are experiencing housing stress. So they're spending unaffordable amounts on their housing. And again, this is more prevalent amongst lower paid occupation groups and in inner subregions. So you can actually see in the table there, this again shows the inner subregions of Sydney. I've selected Sydney because it was slightly worse than Melbourne. But you can see delivery drivers, so 46% are living in households in housing stress. You can see age and disability carers, 40% living in households that can be classified as in housing stress. So comparing where key workers reported that they lived in 2011 versus 2016, we found evidence that key workers are leaving inner subregions. So we found that more key workers reported living in inner subregions in 2011 than reported living there again in 2016. And outer suburban areas and satellite cities tended to gain key worker residents. So, I mean, this is not a trend that's unique potentially to key workers. There were people in that 20 to 29 age cohort were moving in to inner subregions, but there was a significant outward migration of key workers age 30 to 44, and that's significant because those people are often the more experienced workers. Right, so our interviews revealed that housing challenges are really greatest for key workers who are younger because they're less likely to be homeowners, lower income workers, and those who are in casual work or on short-term contracts, for single people in single income households, and for workers with dependent children. We also found that affordability isn't the only challenge. It can be difficult, for example, for workers to find appropriate rental housing in tight or competitive rental markets, often in a short time frame when they receive their assignment or they receive their first job. And we found that homeownership is a very strong aspiration for many. It often coincides with career progression, and that can be a driver to relocate or transfer out of inner city areas. We also found that key worker jobs have unique characteristics. They have to be performed in person, as I've already said. They can be physically demanding. They are performed often over long shifts during antisocial hours, and they produce high stress and, in some cases, potential for vicarious trauma. And that the stress and fatigue can really exacerbate can be exacerbated by housing stress and insecurity and commuting, and that combined with the high cost of commuting, it can have implications for workplace health and safety, for service quality, and ultimately for the retention and availability of more experienced workers. Right. So what we conclude in the report is this really points to a need to increase the overall supply of housing that's affordable to people on low and moderate incomes, particularly in those intermediate tenures between social housing and private market. And we identify a number of ways or a number of actions that can support that. These are things that have already been identified in some cases as ways to increase the supply of affordable housing in Sydney and Melbourne. But we see potentially a role for the use of public sector land to deliver affordable housing for key workers, potentially allowing or encouraging employers to develop housing for their own workers, for example, by allowing housing development in non-residential zones, but only where it's for the purpose of affordable housing for key workers, initiating inclusionary zoning requirements to deliver affordable housing for key workers in the redevelopment of health and education precincts, support, for example, for models that can secure long-term affordability like community land trust models, supporting or encouraging more super funds to invest in housing, and also developing or expanding a government shared ownership program using some of the properties that would come forward through some of the initiatives I've talked about. It certainly wouldn't replace the need for affordable housing, but government support for a purpose-built rental sector we conclude could be helpful in helping key workers to access rental housing on short time frames, and that the value of that sector could really be maximized if landlords were required, for example, to lease a proportion of units to key workers, particularly where the developments are located close to major key worker employers, if they were required to prioritize key workers, for example, in tenanting decisions, and of course, if they were providing a proportion of affordable rental housing within their developments. Now, we recognize also that implementing these approaches requires governments to define what a key worker is and to prioritize particular occupation groups or individuals within those groups who have demonstrated housing need. And although there are compelling reasons for governments to enact policies to support key workers, there's nevertheless an equity consideration. Particularly when we consider the scale of housing need across both Sydney and Melbourne. So what we suggest is there's potentially three pathways forward. One is for governments to take a view that all workers make an important contribution to the performance of cities and to work to significantly expand the supply of affordable housing in those intermediate tenures. One is to take a very targeted approach, so focusing on specific occupation groups where there is evidence of risks to the quality of essential services arising from recruitment and retention challenges. And a third option potentially is to implement or pilot some new policies and programs, targeting them specifically to key worker occupation groups, but then to expand them over time to a much wider cohort. And that's more the approach that we've seen in the US and the UK. So this is just to conclude, I think what this research really demonstrates is that it's generated new empirical evidence that shows that key workers are indeed struggling to afford housing. And it's not just lower income key workers, it's actually, there's evidence of housing affordability challenges amongst workers who earn incomes in the Q3 range. So they really are moderate income workers. But of course, our research is a snapshot. We've used, the census data. We've looked at affordability at a particular moment in time. So there's absolutely a need for more longitudinal analysis so we can see what the trends really are. and also to look in a bit more detail at the regional dimension of these issues, because it looks like it isn't just confined to the capital cities. There's a clear rationale, certainly, to address housing affordability and the spatial mismatch between jobs and affordable housing. I think we've articulated that, or the research evidence articulates that, particularly in terms of economic productivity and welfare. But actually, this adds another dimension, which is that it's about the functionality of our cities too, and it's about their public health and safety. Despite that clear rationale, there is an equity question that needs to be worked through in the design of potential responses or programs, and I've sort of talked about potential ways forward in the last slide. And I think finally what we need to think about is, post-COVID, even if central cities become less of a focus for settlement or population growth, I think inevitably there's going to be a strong need to plan for affordable housing for essential workers wherever there's population and housing demand. So I'm going to conclude there and let Leonie respond.
Terrific. Thank you, Catherine. That was a really insightful and fascinating presentation. Some of those maps are quite compelling. I'll encourage everyone to start firing in questions using the Q&A panel on the right of your screen. But before we come to those questions, I'm really pleased to turn to Leonie King for a sector response.
Thank you, Michael, and thank you, Catherine. I thought I might just spend a couple of minutes just talking about the key takeaways for me, and then relate it perhaps to some of the experiences that I've had, or City West Housing has had, as an inner city affordable rental housing provider in the inner parts of Sydney. So obviously the premise for the research was looking at the spatial disconnect between affordable housing and jobs, and how that impacts in terms of individuals and their commute to work, levels of housing stress, their types of tenure, so the requirement or the need perhaps to live in share houses, perhaps at a greater proportionality than the general population, and issues around relocation. And then Catherine and the research team go on to look at implications for productivity, quality of life, environmental sustainability. I particularly liked the framing around public health and safety of some of these workers, and I can comment on that in a minute. Looked at what government responses might be internationally and in Australia, and what some potential policy responses might be. And perhaps what's fairly unique for this research at this point in time is that debate around, or the attempt to define what might be an essential worker. And I 100% agree with Catherine, it's not a well understood term. Affordable housing is not a well understood term. Key workers is not a well understood term. It means different things to different people, and probably for many of you participating in this webinar. And introduces that interesting element of COVID, and what does that mean, particularly for low to moderate income workers? What does that mean for the city's resilience, which has been a hot topic certainly in the city of Sydney in the past 12 months, and what are the longer term risks for cities? So obviously Catherine looked at a range of occupation groups and defined 21 groups, I think you mentioned, Catherine, around workers, and that would certainly fit with what we kind of view as key workers. So in City West Housing, we would also look at not just the nurse, but the cleaner in the hospital. Although I think it's fair to say our definitions are slightly broader. So we look for people with a connection to the city. One of our eligibilities, you're working in the city, if you're a worker. But we also, I don't know if I'd define them as an essential worker, but we also equally would, we house, people who are working in the back of a house in the Star City Casino. So I think people have probably personal views about whether that's key workers or not, but they're obviously part of a services industry that's about the vibrancy, the livability and the economy of the city of Sydney. Catherine's study looked at, what are the policy responses and projects and programs, found that those can be sporadic, that they're largely contained to the use of the planning system grants and some home purchase assistance schemes. And while the focus was obviously on Sydney and Melbourne, there are obviously broader implications, and we're seeing that certainly in New South Wales, up and down, the seaboard and the sort of eastern seaboard, and particularly in popular holiday destinations such as Byron Bay. And not surprisingly, the statistics show that not a lot is affordable to people in these occupations and on those salaries that this study talks about across much of Sydney, Melbourne, and also in satellite cities, and also in those regional coastal areas. And what I thought was interesting, particularly for me, for City West Housing, given where we operate, is that a third of key worker roles examined are located in the inner suburbs of these two major cities. I also found it really interesting that you managed to quantify the distance travelled, so that you've got workers travelling 30 plus kilometres to get to work, which is a reasonably horrifying statistic if, as you say, a number of them are shift workers, and if they're living closer to the city, they're often in share households. So City West Housing, so we own and operate around 900 apartments in the city of Sydney. So they're all, well, we're classified as an affordable housing provider. They're all affordable rents for as long as people need them, who meet our eligibility. And this research completely correlates with the kinds of demand and some of the issues that we're seeing. So to give you an example, we have been in numerous discussions over a number of years with the Police Academy in Goulburn in New South Wales, training new police cadets. Sometimes and often those police cadets, their very first posting is to the inner city of Sydney. It's a 3-year posting, so they don't have a choice. They can't afford housing in the area. So the stories we've heard is that they might actually be living in the family home, often on the outskirts of Sydney or in those satellite cities or in the Central Coast. They're doing shift work. They can't readily commute every day or on the days that they're working, because we're talking easily a 1.5 hour drive, that some of them are choosing to sleep in their car because, their shifts might end in the middle of the night, or they're sharing incredibly unsuitable accommodation, so a studio apartment where they're overcrowding, and that they're seeking a transfer as soon as their 3-year post is up. Another example is we have obviously people who are nurses, again, shift work, long commutes. Often they're very excited when they get affordable rental housing, but we don't have a lot of it. They're very car dependent. So we're building medium density developments in the city with not a lot of car parking. So at the moment and it's really expensive to do basement car parking as well. And generally, while our apartments are very well located and there's plenty of public transport, if you're a single female nurse in her 20s or 30s finishing a shift in the middle of the night, there is no public transport, and it's a scary place to be trying to get home. So we prioritise, for example, some of our limited car spaces, which is just another element to think about to those people who are shift workers for that safety aspect. We have some other interesting challenges. We don't do a lot of marketing. We've only got 900 apartments. So there's plenty of demand, particularly at the lower end. But we don't want to set expectations for people by creating a long waiting list, because our vacancies are low. And while we have a pipeline of developments take a long time to deliver. And so that is a challenge. And land in these locations is exceedingly expensive. And so Catherine talked about some policy responses and some potential options around use, for example, of industrial land or non-residential land for key worker housing. And I would say access to land that we can afford to purchase is one of our key issues, particularly in these high-cost markets, which are already quite dense, but also where land is expensive. We charge an income-based rent, so that is absolutely focused on trying to keep affordability within our product. But, equally we could charge, which often happens in our sector, a discounted market rent. And I know from fact that we have a building in Glebe, which is an inner city suburb of Sydney, where we're charging income-based rents. There's a building in front of us which has some privately owned affordable housing under the old NRAS scheme, where it's a discounted market rent and tenants are paying $200 more a week in rent, which is a huge amount. And, there is limited choice and people do what they will do. So I would also say my observations from the model we have is that it doesn't really support shared housing. So in our industry, we have to set rents, we have to set eligibility criteria. We have to assess applicants on the basis of income eligibility. And the moment you put 2 or 3 or 4 key workers who are earning penalties and overtime into one household, they will exceed the income eligibility. So there's a disconnect in terms of even just, how well our product can respond to some of the unmet demand in the area. And the other thing we notice, and I think, again, this is picked up a bit in the research findings, is that once people partner or they want to have children or they have children, they often relocate to live in a cheap area so that they're trading off travel and distance to work and hours of work and when they work and whether it's completing shifts early in the morning or at late at night, with access to more land, a bigger house, etc. So apartments, I think we will increasingly see bigger apartments, being more attractive to people and being attractive to those larger households. We're seeing a push towards the build-to-rent movement, but at the moment it seems to be an issue. So just very briefly before Michael throws open to questions, just quickly looking at the government policy responses. I've worked across government in affordable housing policy, as well as now in a service delivery organisation delivering affordable housing in New South Wales. I would say there is no one size fits all. There's an interesting question around public good. So I think, for example, it's easier to demonstrate the benefits of affordable key worker housing as defined in this study to local government, perhaps because of the productivity benefits and the livability arguments, than it is to the state governments. There's limited funding overall across Australia for all forms of low-cost subsidised housing. The state governments are typically focused on the social housing system, which because they have a direct service delivery role and because there are often significant waiting lists and lots of unmet demand. So it's quite difficult in my experience to get attention on the key workers at that state level. And the Commonwealth government is heavily focused, in my experience as well, on home ownership. And I know that is some of the policy responses that this study has recommended, but there is a challenge, particularly in a high-cost market like Sydney and in the inner suburbs of Sydney, around realistically what kind of depth of subsidy or support would you need to enable someone to be able to live close to work when they're working in those higher cost areas. And typically governments intervene when markets fail. It's interesting. So all of the evidence, all of the data, this study suggests that the private market is failing, the private housing market is failing to meet the needs of these people. But again, I in my experience, I don't often see that it's getting traction, that this information, that this data is getting traction at a government level in terms of generating a government policy response. Possible reasons why is that there's too many fish to fry. There's too many competing demands on the public purse. It's too big an issue. It's too big a problem to conceptualize. I often hear in a policy sense that this cohort have greater capacity to meet their own housing need than perhaps some people on even lower incomes. So it's a question of equity, but with a slightly different lens. And as I mentioned before, and something we find is there's also an interesting question about the ability to meet demand for different household formations. So I'll leave it there and I will hand back to Michael.
Terrific. Thank you, Leonie. Some really insightful and fascinating comments there. Look, we've got a wealth of questions come through already, but if you've got a point you'd like to make or a question you'd like to put through, please don't hesitate to put that in, and I'll try to draw together themes from the many comments already coming in. We might start with a couple of definitional points, I think, and as just a bit of a foundation for the discussion. Catherine, one of the first questions to come in really was about the defining the terms for affordability in those maps you presented, the red, orange, and green zones. How did you define housing affordability, particularly for the purchase of homes?
We did it on the assumption that mortgage payments or rents would have to be equal to or less than 30% of the income. So that's, I mean, it's the 30% rule. It's an imperfect measure. I mean, it doesn't take account of different household configurations and things like that. But you know, it's a widely recognized measure, and just to get sort of a high level for the high level analysis, we thought it was sufficient. So yeah, basically, as long as the mortgage payment or rent for the median priced property wouldn't exceed 30% of the income we were looking at.
Terrific. Not surprisingly, there are a number of questions and comments about the definition of key worker. Look, it's incredibly topical today to be discussing this. You know, listening to the radio this morning, the definition of an essential worker is uncertain at this point. You know, in Victoria last year, we had permitted workers or permitted workers. I'm not sure which one you want to use for that, but you know, a permit-based system for freeing up workers to move around as they were required to. There are a range of definitions, and I think the set of industries or types of role that you identified in your list there was really sensible. Some of the questions, though, speak to length of service. I mean, should we define length of service for some of these roles that are not necessarily long career roles, but might be transitional roles or shorter term roles? How do you handle housing solutions for people who are in a role that they might only stay in for 1 or 2 years? And I'm going to also bring in at the same time, because there are sort of, as I say, a number of questions here. There's a gender lens on this as well. A number of the caring industries, the nursing industries, aged care, and so on. There are a number of industries that were represented there were female-dominated industries still. So does that skew the responses required? You know, what are the implications of that for housing solutions? And that is a question for both of you. Catherine, do you have a comment on that?
Yeah, I mean, I'll go back to the first thing, which was a definition. I think we've certainly seen the potential definition expand rapidly in the context of COVID. But I think there's a difference between defining key worker for the purpose of who can sort of go to work during lockdown versus, you know, who is in sort of a long-term need of affordable housing. I think those are slightly different things, but certainly the pandemic has pointed to an expanded definition of what roles are essential. And I think certainly a core aspect is having to be physically present for work. Yeah, I mean, in terms of the gender aspect, I think, yes, a lot of those roles are still, you know, female dominated. I don't know if, Leonie, if you think that affects demand in some ways. I mean,
yeah, we see, particularly for the working households, we are seeing quite a high percentage of single households single female households. Now, not all of those would be defined as key workers in this, but they are in work, often in casual work. And increasingly as in the older age groups, because people are having to work longer, so they're doing fewer hours, and that this is not what this study is about, but I'm seeing a lot of casualised work for many of our residents. So
that's certainly a theme that's come through in some of the comments and questions already. The impact of casualisation of labour markets, and what does that mean for, I guess, defining people's industry, defining their eligibility.
And while this study and I think the definition shouldn't hinge on what is a key worker in a COVID world, I would say our experience is because of COVID, is that those older women in those part-time or casual roles lost their jobs first time round and they haven't regained them because they are not in an age cohort that is competitive when it comes to regaining employment when there are reduced numbers of jobs.
And we certainly found in the study that, you know, while some key workers are able to search for jobs in other locations that are more affordable, some, particularly people in some community welfare roles working, for example, with homeless populations, they actually are very heavily concentrated in central city areas. And those industries are also characterized by a lot of casual contracts. And often, you know, workers don't have a lot of, you know, they need to take the work that they can find, and potentially commute very long distances. But you know, the stress of commuting and not being able to secure appropriate housing that meets aspirations, that meets needs, I mean, that does cause people to leave the sector and to move into other areas. So there is definitely, I mean, just in terms of the question of how long people are, I know that the question was more about, you know, what if people's careers are very fluid throughout their life, and, you know, and we're developing policies to help them into housing. Well, actually, what we were looking at more in the study was that evidence that there is difficulties with retention that are directly related to inability to access housing.
Yeah, and I'd just make a comment too in terms of what people often think is the traditional definition of key workers. So those employed in some form of public service, you know, teachers, ambulance, often they don't get a lot of choice in where they're posted. You know, schools are where they are. How many teachers have to, their first post is in the country, and then, you know, you just don't necessarily get to choose. There might be a bit more choice, you know, if you work in a hospital, because there's probably a bit more mobility, but a lot of these professions have very limited mobility. You don't get to choose your posting. So
Absolutely. So one of the themes that's coming through is you acknowledged, Catherine, that the research was using 2016 census data, that I guess new data is not far away in terms of the next census round, and looking at that trend. And obviously there was a clear trend between 2011 2016 that you highlighted. What's your sense of where things have gone since 2016? And, you know, where are we heading? Is this a growing problem in not just Sydney and Melbourne, but across the country, and in particular in the regional centres? There are a number of questions asking about, I guess, smaller cities. What's your sense of that?
I mean, again, I'm speculating because, as I said, you know, we really only have data for the 2016 period. That's our most recent data. But I mean, I would speculate that probably that the situation has gotten worse, because, I mean, we've seen the housing market is going crazy. And in particular, it's going crazy in, you know, outer suburban and regional areas. So satellite cities, you know, the Illawarra region, it's going crazy. The housing market here, we saw that already based on those 2019 sort of price data, that already affordability was an issue on even moderate key worker incomes. So I would suspect now the situation is worse.
Sorry, your audio just cut out for me for a moment there,
Yeah,
but I think you're absolutely right. Sorry, I might have spoken over you, I'm not sure. But some of the other wider AHURI current research has looked at this question as well, and you're right. This is not just an issue in the two biggest cities, but is spread across many smaller centres, and both the rapid price rises and the very low rental vacancies across the country are really strong indicators of this challenge.
And I mean, I think
there are a number of questions.
I
Sorry?
think we found, it's barely viable to commute from the Central Coast or from the Illawarra. It's certainly not viable to commute from, Narra or the Shoalhaven, right? So, the question is, how far are people going to be pushed, outside of the metro regions?
Absolutely. So one of the themes that came through, I guess, looks at purpose-built rental accommodation, and built to rent, which in this country we've been hearing about for quite some time as a potential solution, but the yield gap has been a challenge, or the financial modelling hasn't necessarily come through. Tell us a little more about specific programs for build to rent that focus on key workers, because I guess that hasn't been a strong flavour in the small initiatives, or the relatively small initiatives in this country so far.
Yeah, well, what we found was the example that I alluded to, which was it's coming from Massachusetts, where it's really just offering very low cost loans to developers to build, who are already building purpose-built rental. And of course, in the US, there's a huge sector there that's already established, but it's providing very low cost loans to developers who will include a proportion of affordable units already within their rental projects. So that was the case that we looked at specifically for this research. So we haven't looked at it. We didn't look at it in the context of a country where there isn't already, somewhat of an established build to rent sector.
I think I'd add, though, that obviously the private sector is struggling to get build to rent work in particular markets in Australia, and particularly Sydney, I'd say, perhaps a little less so in Melbourne. The likelihood that it offers any form of affordable housing product without an explicit subsidy is probably zero. And generally, if you look at affordable rental housing as a product, which is typically provided through the not-for-profit community housing sector, there are already no subsidies for that product. So it's that thing of, swings and roundabouts. Who pays? Does anyone pay? How do you make this work? I often say there might be private developers on this webinar, I'm not sure. I think sometimes they go in getting excited thinking that you can make money out of affordable housing. Hopefully the board's not listening, but I can tell you now you don't make money out of affordable housing. In fact, if you looked at it as a business model, you'd go, how does that work? So, myself and my colleagues in the sector, we make it work through the odd subsidy here, the odd planning, uplift there. For City West Housing, we've been very lucky because we've been the beneficiaries, as Catherine would know, of a long-term inclusionary zoning scheme that levies private developers in the City of Sydney in certain areas for affordable housing. But even then, by the time that generates enough cash, well, what is enough cash? You've still got to be able to find land, you've still got to save enough money to afford to build. And it's not a cheap building product at all. So.
What we conclude in the report is that, a build-to-rent sector is a very small piece of the puzzle that could be beneficial in markets where there is extremely low vacancy and where the quality of the rental stock is not potentially very good. But that actually, it's a very, very small part, and really those intermediate tenures of affordable housing are really what's needed. And we also recognize in the report that home ownership is still quite a strong aspiration for a lot of workers, and they will actually move out of the metro region to become homeowners. Yeah. So, build to rent is very important, particularly, as Leonie said, people who are getting assignments and they have to find housing very quickly. There is a role, I think, for a build to rent sector, but it's not necessarily going to resolve this issue.
So one of the other comments that's come through is I guess extending on that build to rent tenure and that model, that sort of purpose built tenure, the relatively small role of housing cooperatives in Australia. We see in North America and parts of Europe quite extensive housing co-ops as a model, but they've been fairly small scale within the Australian context. Does that provide a good solution for key workers?
Yeah, I mean, we've mentioned certainly that community land trusts or, cooperative models or just some of the new models, if they were supported, they could play a role as well. So anything that essentially secures affordability over the long term would be helpful. And they actually can provide a pathway to becoming a homeowner and, having all the sort of rights and autonomy over your home that being a homeowner has, but without, maintaining that affordability over the long term.
Absolutely. There are also,
I think, as Leonie said, access to land is the key.
Yeah, I mean, the City of Sydney has been looking at it as a model, but I think the issue we have with all these policy responses is that they work in some markets and some contexts. It's the ability, but not all, and its ability to scale things up. And government policy and programs are prone to having short lives, or short to medium lives anyway. So, I mean, if we take NRAS as an example, it took, from my observation, I was in state government at the time, a couple of years for the market to respond to that, to work out what it was and how to make it work. And almost as soon as those, those things started, those sort of frameworks and settings started to be put in place, the program was reduced and then cancelled. So it's tricky. I think the US does offer some lessons in terms of their multifamily housing and the scale of the build-to-rent sector there, but again, not everything is translatable. So,
I mean, one of the things that I think was important to note about the programs is often those programs were piloted originally or sort of started with a very specific cohort of essential workers where there was evidence that they had housing needs, there were recruitment and retention problems. And then over quite a long period of time, those programs were sort of scaled up or replicated to other low and moderate income workers. So they were very slow and steady, but pilots.
apologies for the traffic noise there somewhere, but
that was me. Sorry. Welcome to the inner city.
Look,
But at least I got the dogs to stop barking, kind of.
Absolutely. No, that's fine. There are a couple of questions have come in about short-term rentals, the role of Airbnb in impacting on availability of rental markets. And Catherine, correct me if I'm wrong, but I don't think that was a focus of this study.
It wasn't. Sorry, go ahead.
I was going to say, but your colleagues at Sydney have also looked at that in some of the other work we've done over the last couple of years through AHURI funding, and certainly we've seen particularly in smaller centres and in tourism-heavy areas, the removal of stock from the normal rental market, the private rental market, into short-term accommodation was a clear pattern that reduced availability and therefore affordability. Last year during COVID, we saw a lot of that stock return to the rental market because Airbnb or the short-term rentals were a less viable model during COVID shutdowns. And I suspect we're starting to see that reverse once again now. But it certainly is a factor in some locations.
We did do just a small analysis. Again, in the context of a scoping study, we couldn't delve, in great depth into everything, but we did look at the availability of rental properties in addition to the affordability. I didn't include a slide on that just because of time. But what we did, we used rental bond board data focusing on Sydney. And what we did was we looked at the number of properties in a given month that were tenanted that were affordable to our different key workers. And we found, there were, I can't remember off the top of my head, something like 7% of new tenancies were affordable to, say, someone working as a laundry worker or a cleaner. Those properties were often in more outer suburban areas, usually one or no bedrooms, so not really appropriate for the large majority of families. And then we also found that quite a few properties falling into the affordable range were actually what the bond board classifies as other. So they're not necessarily a conventional dwelling. It might be something like a garage or something like that.
You're really talking about displacement. And if you looked in the inner city Sydney last year, the rentals, you'd say, oh, high rental vacancies, falling rents. Great. except counted in those statistics was a heck of a lot of student housing, which is not a product that is available or appropriate for the people that we're necessarily talking about. And in fact, we've started to see the market correct again, notwithstanding there's large swathes of student housing sitting vacant. And so the question around Airbnb, yes, it did displace. I guess I can't comment on whether it did it at a large scale. The issue we're talking about is, as I said, no policy setting that provides long-term funding or subsidies for affordable housing. That's no surprise for any of us who've been around this industry for a really long time. And the treatment of housing as effectively a financial investment asset. So I'm not going to go into that complicated discussion. The other interesting thing, Michael, is you raise the issues of migration, people demand in regional locations. I saw a really interesting presentation by an economist recently who said the statistics can be misleading, and he didn't think we were going to see, I can't comment on Byron Bay, but he didn't necessarily think we were going to see permanent migration to those areas. We've seen workers and families and households move temporarily, but he said they're starting to come back. In the case of the cohort that this study talks about, they're not people, unless they change careers, that can pick up and just work necessarily from home for a period of time in somewhere else.
Yeah, some of the internal migration figures have been really quite fascinating. It's something that we're going to talk about at the next conference that AHURI is running in Melbourne at the end of this month, the Cities Conference. But broadly, some of the changing dynamics have been not so much about people fleeing the big cities to the regions, but people who would otherwise have moved from the regions to the big city, as part of their sort of early career phase, have stayed where they are. And so, whether those patterns continue long term is I guess up for grabs and uncertain at this time. There are a number of questions that have picked up on, I guess, the transport elements of your presentation, Catherine, and wondering about the possibilities of particular mechanisms that might assist in some of the transport challenges. So exemptions from tolls for key workers on highways, or special transit lanes for key workers in the way that we have transit lanes for cars with more than one person in them on a lot of freeways in larger cities.
So
those sorts of models.
I realized that was on one of my slides, but I didn't actually read it out. So I think I was conscious of the time. So I mean, obviously I've focused on the sort of the housing supply responses, which we think are really, really important. But yeah, in the report, we also look at some non-housing based responses. So we think it's essential because, subsidizing wages, assisting with transport, that's not going to, address this core issue, which is that housing is increasingly becoming unaffordable, but nonetheless still important. So yeah, in the report, we talk about the need to invest in transport systems, that things like relief from tolls or parking costs could help individual key workers actually their net earnings, because what we found, particularly in our interviews, was that a lot of workers there commuting long distances, by the time they paid tolls, by the time they find parking, and pay for parking for a 12-hour shift, that's half or more of their wage gone. So certainly those sorts of things could help a lot with net earnings, which would help to reduce some of the financial stress that the workers are experiencing. I hadn't thought about special transport lanes. That's an interesting idea. So there are other options. There's wage subsidization, assistance with transport costs. The reality is that a lot of key workers are car dependent, not necessarily because they just love driving cars, but because they're working their starting shifts, as Leonie said, at antisocial hours. And often they're going to quite dispersed locations. So things like aged care centers, childcare centers, they're dispersed throughout communities. They're not necessarily on main transport lines.
So it's interesting. We measure, we measure housing stress on the basis of whether people are spending more than 30% of their household income on housing. And so a lot of those people that have chosen or feel they have no choice but to move quite a long way away from where they work and commute. We don't count in any measure that cost. So they might look like they're now renting affordably, but we don't count the cost of their commute to get to their job as a key worker. And I think there was a study in Toronto that some years ago that actually tried to measure that as one of the factors, which is a really interesting question of why don't we, consider that as
it absolutely is. And Leonie, I wonder if you've been reading AHURI's research agenda this year, because it's a topic we've put out
well, not
for
specifically.
applications. Yes. There's we're actually now in the process of assessing applications for a topic that is looking at a more sophisticated understanding of housing affordability that takes into account transport and energy costs as two of the key implications of housing decisions, because each dwelling has an associated energy cost with running it, with maintaining it, and transport costs with attached to its location. So that's something we're working on right now. It's very topical in my view.
And the other aspect Catherine mentioned was around safety and well-being. Appreciate it's slightly different, but it's one of those costs we're not very good at measuring, I don't think.
And there's certainly no opportunity to work from home several days a week to mitigate some of those costs. So they're absolutely they're quite high, quite significant.
So another angle on the transport dimension that's come through as a suggestion, I think, really prompted Leonie by your comment about prioritising parking for certain cohorts, for young female nurses, for example, with night shifts and so on, is the role of sort of car sharing schemes. And could we pair a car sharing scheme with an affordable housing provision so that there's some way to, the logistics of that sound complex. Is that something that's been tried to your knowledge?
I can't comment on car sharing. We have partnered with GoGet to try and, I guess, discourage the use and ownership of cars in the inner city, not least because, we don't have many car spaces available. And look at how we can incorporate that into like car share spaces and into future developments. But I guess if you're a shift worker, your shift's not necessarily going to end. If you work 9 to 5 or 8 to 4 or whatever, you can probably car share. I think it's probably harder in those key worker professions that have odd hours. Would you agree, Catherine?
I'm not sure. I'm not sure what the rules around car share programs are, like how long you're allowed to have the vehicle for. I'm not sure, so I can't comment. I think it's a really interesting idea, though.
Tons more comments coming through, and we're clearly not going to get to all of them, so I apologise if we don't get to the comments you've raised or the questions you've raised, but lots of really interesting themes to unpack here. But one of the ones that's come through quite strongly is how can government policies that are already in place or that exist at different times be better targeted to key workers? So, for example, first homeowner grants or rented by programs. What does it take for them to be really attuned to the needs of key workers? Catherine, this is something that came up in your research to some extent. Do you think there are straightforward solutions to that?
I think the existing programs could be targeted to key workers. I guess one of the issues is if they currently apply to everyone, scaling them back, it's politically difficult. But really what any sort of program depends on is a clear definition and I guess hopefully an evidence base. So I guess if some of those approaches were to be adapted to address the issue of key worker housing needs, it would just be a matter of defining, getting some evidence around which occupation groups potentially are in the most need or where there are recruitment or retention difficulties, and then targeting some of those specifically to those groups. But I think, and then certainly within those occupation groups, looking at where there is need. So, for example, targeting younger workers and non-homeowners or those, in households below a certain income threshold.
Terrific. One of the really strong themes coming through, I guess, is around the role of the private sector, and in particular of employers of key workers. What is the role of the employer in this? In the past, housing for nurses often was built next to or on top of hospitals. That was part of the design. There's a really solid example of a distributed housing model for employees in Defence Housing Australia as a means of housing armed personnel. Is there a role for employers in supplying housing, as we've seen in some other countries? And what does government need to do to encourage it?
Yeah, I mean, just on the what can employers do question, I think it's important in the context of this study. One thing that came out in our interviews is that, wages are essentially fixed either because they're coming from statewide industry award scales, or because in some industries contracts are short term, they're highly competitive, and the person who wins or the organization that wins the contract often does so because their costs are the lowest. So there's not necessarily an ability for most employers to increase wages as a response. But yeah, I think there's certainly a role for large employers, to potentially use land that they have to provide, to partner with, say, community housing organizations and deliver some housing specifically for key workers.
I think some of the hospitals have looked at things like that, but outside of major sort of regional, like major cities, I think there might be more access to land. I think it's much harder. The closer you get into the city, it's all, land is a scarce commodity, and there are many competing demands on it. So,
absolutely, and with that sorry, you go, Catherine.
Oh, I was just going to say the other thing that I think came out of our interviews was also that not all key workers want to live right next to their employer, and it depends on the nature of their work. So for some people, that is very convenient, but depending on the nature of their work, they may want a little bit of a spatial, separation between themselves and the people that they're serving potentially.
I think anyone who worked from home for a large chunk of the last 12 months or so will understand the desirability of separating your working life and your home life at times. But obviously, and I guess that does lead into one of the other comments here that I guess contesting the concept of a key worker and really saying it's just an income question rather than an occupation question. But I guess one of the points around the definitions of those industries, Catherine, that you listed earlier, is about the need for face-to-face presence in those roles, in a way that, for example, someone working in an office could potentially work from home much more readily. Is that really the key defining point?
Yeah, I agree that income is a major driver of the housing needs, but in terms of the rationale for intervention, yes, it's actually it's about the functionality of important public services that we all benefit from. And it's recognizing that these jobs are unique in the sense that they, like what I said, they often accrue quite a bit of stress. They're physically demanding, performed over long hours, and that the housing insecurity and housing stress, long commutes, that just exacerbates a lot of the fatigue that's already accrued and can lead to people leaving the sector or to burnout and things like that. So I think there is a strong rationale, but obviously your occupation status alone isn't necessarily enough to necessitate, some sort of intervention. So it would have to be a combination of a particular occupation and actually looking at income within, like income and housing needs and household dynamics within those occupation groups.
Mm. Terrific. Look, there are, as I've said, many other questions we haven't got to on really diverse topics, well outside the range of the presentation today, looking at adaptation of commercial buildings, public awareness of affordable renting and whether or not there's sufficient awareness of it. The framing of housing affordability as a public health concern rather than as a housing issue, and of the provision of it as infrastructure, not just as a private sector that may or may not be functioning as it should, and particularly about the potential cost to government long term if this is not addressed, if the trends in fact continue. So look, there's a lot there we could speak to, and for those topics that are, I guess, beyond the scoping project that Catherine's presented today, I would encourage anyone watching to look to the AHURI website, because there's a wealth of information on all of those topics and much more as well. But for today, we have reached the end of our time frame, and so really what I want to do now is to thank Catherine and Leonie for speaking in today's webinar. I apologise, some of the connections have been a little bit fraught today. The audio has been a little bit scratchy at times, but thank you for bearing with that. And thank you for presenting really interesting research, Catherine, and Leonie. Your experience in responding to it has been very highly valued. I also want to thank everyone who's joined us today. I'm aware that for people in New South Wales and the ACT, it's a difficult time, and extend our sympathies and understanding for that, and hope that resolves as soon as safely possible. We will continue, AHURI will continue to present webinars on a monthly basis, with the next one to be announced quite soon. And if you want to make sure that you're aware of that, you get the invitations in your email, make sure that you subscribe to the AHURI news through our website. And this month, there's more. We're going to come back to you with a really interesting program at the end of this month, in person and virtually. So you can join us in Melbourne or online, whatever's going to suit you best, for a one-day conference, a full-day conference on the uncharted urban futures, the how do Australian cities work post-COVID-19? We'll examine the population dynamics as a result of the crisis, the delivery of social infrastructure to support our changing cities, and the particular urban transport challenges emerging from the pandemic. All topics that we had questions on today that we'll get to at that conference as well. So I invite you all to join us on Thursday, the 29th of July, as I say, in Melbourne or online, to be part of that really important national conversation. Registrations are already open, and the link is on the screen now, and we'll be sure to include that in our post-webinar email as well. So just a very quick reminder that we would like to get your feedback. Please complete the survey that will be sent to you today. And if you do want to share this webinar with any of your colleagues, it'll be loaded onto our website shortly. So until we see you again on screen or in person, thank you for joining us today.